doesn't matter how you have passed your first and second year, how much you have read, or merely just passed your exams or even flunked, does not matter. What matters is now.
Yeah.
You start, and if you start right now, you can definitely get a top rank in NEET PG or INICET and get your desired branch. There's ample of time in third and the fourth year, provided you have that consistency throughout, you are gonna achieve a great rank. Now in this video we'll be talking about everything, be it the resource, be it the plan, how to manage your coaching, your postings, how to manage the coaching notes versus the standard textbooks versus the coaching videos versus the college lectures. And we'll also talk about that how you should manage your prof as well as NEET PG. Now, before beginning this video, certain don'ts which I want to highlight. Point number one, a mistake which many people do while starting their third year is that they start by catching up on their first and second year. Now, what happens that way is that neither are they able to completely catch up their first and second year, and the third year also studies gets compromised.
And the problem here is, Aman, that first and second year subjects, as far as your PG preparation are concerned, has a limited content. And if you talk about third and fourth year subjects, medicine, surgery, obs, gynae, pediatrics, they are endless.
So the better idea would be that rather than completing first and second year and third year, it is better that if you can just do 40 or 50% of your final year, the important subjects like medicine, surgery, obs, and peds. So that will help you maintain a smooth final year, as well as you will have ample of time to revise first and second year in the
internship and post internship. And it doesn't matter if your first and second year was bad. There are ample resources now which will help you learn those first and second year subjects in detail, and first aid is one of them. But this is not the time for that, right? Third and fourth year is the time to dedicate for third and fourth year subjects. We'll come to first and second year subjects in internship and post internship.
Now coming to the next point, GTs. This is not the time to give the GTs. This is the time to build your concepts and strengthen them. And please don't give GTs. Yeah, you can solve question bank, you can solve questions, but GTs not as of now. The other mistake which many of you do is that most of you and most of your batchmen, most of your seniors would be doing the same thing. First, they watch the coaching videos. Then they see the coaching notes. And if they have time, which mostly they don't, they go for the textbooks. This is not the way. We'll tell you the way ahead. Over to you for the plan.
And the problem with this videos, notes and textbook sequences, Aman, that once you watch the videos, then you read the notes. But by the time you're reading the notes, you've forgotten what you've watched, what you've seen. So you watch the video again. So it takes double the time to read the same content. And that is why we'll tell you how to read this. Now let's come to the plan. Now third year has 4 subjects, FMT, PSM, ENT, Ophtha, and these are minor subjects. Only one major subject among these, that is your PSM, right? And this is a big subject and very important subject both from your prof and your PG prep. Prof, maybe there is a lot of weightage for PSM which is given.
As well as for becoming a good doctor, you actually need to be very in your PSM posting, in your village posting, you need to note this subject.
You should read PSM well. Now the idea is to spend majority of time reading your PSM, and other minor subjects, ENT, Ophtha, FMT are small subjects, you can cover them easily. So prof based preparation, right? So what I mean by this, university exam oriented preparation start 2 months before the prof. So let's say your exams are in January or February next year. Start your prof oriented study from November. That is the idea. So what to do till November? Now study according to the posting schedule. That is the crux of this video. You have to study according to the posting schedule. So let's say you have a 2 weeks rotation in medicine. A lot of places have 2 weeks rotation, 4 weeks rotation, or 6 weeks rotation. For example, AIMS has a 6 weeks rotation in third year. Similarly, in fourth year, a lot of places have 2 weeks rotation of medicine, which happens recurrently every 3 to 4 months. So depending upon your college. Now, if you are in your third year, the idea is if it's a 2 week rotation, complete 20% of your medicine schedule or your medicine content in your third year. And if you are in your fourth year and watching this video, you have less time, But since only 2 weeks are left, you'll only be able to cover 30%. And if you're 4 weeks and 6 weeks respectively, you can increase this percentage to 40% and 60% respectively. That is the idea, how much content to cover in one posting. This is regarding a major posting. Now you'll have minor postings as well. For example, Dharma, Ophtha, Psyche, ENT, Ortho. How much to cover in this duration depends on how long this posting is. So if it's a 2 week rotation, try to cover 50 to 70% of that posting if it's in your third year. And if this minor posting is in your final year, you'll have to unfortunately cover 100% of your content in this major post, in your minor posting, right? Now, PSM, when to read PSM. So if you're in your third year and you have your village posting, which most of the medical colleges do, try to read PSM during your village posting only, because PSM per se is a very boring subject. You don't feel like reading that subject, right? And since you are in the rural area, rural community, you're seeing the rural health center, it is easier for you to grasp PSM concept.
And whatever patients you are seeing, you can come back and read that concepts
From
later.
The
The programs which are in your
Yeah.
PHC, you can read about
Yeah.
them. So that is basically seeing and learning and
Yeah.
then coming to the room and then
Yeah.
reading again. Now coming to the resources, how to actually read. Now the best thing which you can do is that rather than going with the videos
Yeah.
of the coachings, the better idea is to go for the for the notes.
Notes. Yeah.
And these are the full notes, not the revision notes.
Yeah, so you'll be having main notes of your coaching. Now it doesn't matter which coaching you take. Okay, so we are not here to suggest you any particular coaching. Any app would do, and in fact, in current scenario, all apps have standardized content.
However, the lectures
Yeah.
of different faculties, you might not get a frequency with certain faculties. So however, the notes is basically similar for
Standardized.
all the coaching. And the second thing is that you can get notes free also from
Yeah,
Telegram channel.
exactly.
So what we are saying is that first you read the coaching
Coaching
notes.
notes. Yeah.
For those topics which you do not understand, only for them watch the full
Full
videos.
Yeah.
And after that, what you do is you read the standard textbook and annotate in your full notes anything from your textbook which you feel is important and additional.
Yeah.
Because you will not be able to revise your textbook during the last time.
Yeah.
However, you will be able to revise your
Notes.
highlighted notes.
Exactly. Very nicely said, Aman. And the idea here is to build concepts, right? So let's say you are reading medicine, your medicine posting is going on, you have 4 weeks of medicine. So what I have targeted that in these 4 weeks, so I've given an example, medicine posting, third year, I have 6 weeks in AIMS. There is 6 weeks of medicine posting. Now target was according to 6 weeks, 60% of content in this posting. So 60% becomes 6 units. So start with an easy unit. Now in medicine, the easiest unit according to me is rheumatology. So start with rheumatology, respi, nephro, endo, GIT, hemat, 6 units. Try to cover it in this posting only. Now, how to cover these 6 units? Now first read notes. Okay, whichever coaching notes you have. Okay, let's say you are reading diabetes in endocrine, or in rheumatology, let's say you're reading SLE. So you first read SLE from your notes, annotate extra things from your textbook. Now which textbook to read in medicine will come to just in a bit, but the idea is you have read notes, annotated extra things from your textbooks, and let's say there was a concept in rheumatology which you were not able to understand by reading textbook or notes, then watch that video. Only then watch that video, because video watching takes a lot of time. And I know you love watching videos because background it keeps on playing. You watch it in 1.5x, 2x, and it gives you a sense of completion ki, oh, I've understood the topic.
But the point is, videos are not
Yeah.
revisable.
Yeah.
However, notes are.
Are revisable. Yeah.
Please remember one thing, that you are not going to have the same amount of time to revise what you are reading in the
Exactly.
first time. So
Exactly.
please make a note to highlight
Yes.
your notes.
Yes.
And in that also highlight, there can be a structured highlight that you can use different color. For example, yellow less important, blue more important than that, green even more important, red the most important.
Yeah.
Develop a style which you wish, so that according to the time you have for any subject's revision, you can later use them as a revision source.
Yeah, and you will say, sir, it is taking a lot of time. That first time reading notes, then I'm adding extra things from textbooks, and plus minus I'm watching videos. But this is your one-time investment. The next time when you read these notes, it will take 1/3 of the time. And if you just watch videos, you'll have to re-watch the video the next time when you want to revise that subject. So that is the advantage of this approach: notes, textbooks, plus minus videos. Okay, now along with your coaching notes or textbooks, you'll have to read bedside clinics book as well, because you'll be posted in medicine and you'll have your end posting viva. And bedside clinics are both important for your life, for your prof exams, and in general for becoming a good doctor, right? Now, so for medicine, personally, I recommend Kundu and Algappan. These two are good clinical books. Now, Hutchinson is a good book again. I would suggest read Neurology. Neuro exam is very well given in Hutchinson. Read this, and again, MSK exam is also well given in Hutchinson. You can read these two from there. So this was regarding medicine. Now let's say you have your short subject derma posting coming up. So try to finish 70% of your derma content in that posting. So the order is same. You read your derma notes, read the textbook. Textbook for derma is Nina Khanna. We'll come to that in just a bit. Plus minus video. Whatever topics in derma you're not able to understand, only watch that from your video. Right? So your notes become your core base. And over that, you keep on building, keep on building, keep on building. So this is the basic idea. Now, which textbooks to read? Let's come to that.
So for medicine, Harrison, CMDT, and Davidson, these are three standard books which you can refer to. Now, Harrison is actually very vast.
Yeah.
So what I went through is that the pocket Harrison,
Yeah.
and the important tables, emergencies is beautifully given in
Yeah.
that. So that will be kind of a revisable content and will help you pass your prof exam as well, and will help you in PG preparation as well.
Yeah,
Now, the whole Harrison, Dr. Rishabh, no one can guide you better than him.
Yeah, so actually, Aman is very right. Choti Pocket Harrison, we call it Choti Harrison, has very good graphs and very good tables, and they're revisable. Question directly come from there. What I would also recommend is add your clinical approach chapters. So read your clinical approach chapters from Harrison. For example, in the first part of Harrison, there is separate list of topics wherein there is cardinal manifestation of diseases. For example, approach to jaundice, approach to ascites, approach to splenomegaly, approach to hemoptysis, etc. These things are very important both from your prof exam point of view, PG point of view as well. And you'll able to understand the subject when you watch this clinical approach chapters. For systemic chapters, let's say diabetes, rheumatic heart disease, core clinical chapters, Choti Harrison or Pocket Harrison is good enough if you're adding it in your notes. Now, another good book I would recommend is
Current Medical Diagnostics and Treatment.
So CMDT.
So every year a new book is released, and it has all the current algorithms and flowcharts.
Yeah.
Diabetes is something which is given beautifully. The targets of BP, the targets of the HbA1c, and all the current guidelines are maintained.
Again, hematology is very good, very nicely given. So hematology is very nicely given in CMDT. So you can read that. Harrison में in fact थोड़ा touch नहीं है hematology, right? Now Davidson, a lot of people suggest Davidson. I started reading Davidson. The problem I had with Davidson was that it did not have official guidelines. You know, like CMDT, Harrison has proper society guidelines. I did not find that in Davidson. So if it if it rocks your boat, maybe okay, Davidson is fine. I personally would prefer CMDT if Harrison is a little tough for you. Now, my personal approach how to read Harrison is a lot of people when they start a chapter of Harrison, they start from introduction, epidemiology, and pathology, and by the time they reach clinical features, they are bored. So start from clinical features and complete till management, right? Intro, epidemio, and pathology are not so important, and it will constitute around 50% of your chapter. So start from clinical features and end till management. Now, in ECG per se for medicine, there is a very good book by the name The Only EKG Book You'll Ever Need. And believe me, this is the only EKG book that you'll ever need. And it is by Malcolm Thaler. A very nicely written book, okay, very easy to understand. It explains ECG in sort of a storytelling way, and it has around 10 to 15 pages at the end of this book summarizing the entire spectrum of ECGs that you need to know from MBBS point of view. So very, very good book. I personally would recommend. A lot of students read ECG Made Easy. I don't think that's a good book. Goldberg is again a book of ECG, very high level. I don't think you need to read so much ECG. This is a very good book for ECG you can read. Now, don't be disheartened if you can't finish Harrison. You know, you are
because no one will be able to.
Because-
Even people in MD are unable to finish the entire Harrison.
Yeah.
So you being in your MBBS, whatever you are able to read, just feel yourself blessed to be reading that. but don't be in the FOMO that you are unable to
Yeah.
complete.
And since most of the coaching notes now directly take content from Harrison, so indirectly your Harrison will be covered. Just read cardinal manifestations of disease from main Harrison and plus minus topics or tables from Choti Harrison.
And similarly in surgery as well, Bailey and Love is the standard book,
Yeah.
but most of the coaching notes you will find exactly Bailey is being copied in a shorter and a more recollectible manner.
Yeah. So again, Bailey in Love, I have read Bailey in Love. It's a good book. Again, general surgery, very nicely given. GI surgery also nicely given, but I think for GI surgery, coaching notes are better. Another gem of a book which I think a lot of students don't know is this Washington Manual of Surgery. And this is a very small handbook, like a Choti Harrison. It's very thin only. Not very thin, thin from MBBS point of view. And it has, again, algorithms and flowcharts of how to approach a disease. So particularly, I would recommend Washington Manual of Surgery for breast, for trauma, for burns, and in fact, hepatobiliary as well, biliary disease. Very nicely given.
So breast, trauma, burns, and biliary disease.
Yeah. Now, Manipal Manual of Surgery and SRB are, Indian textbooks from prof point of view. For example, a lot of seniors say if you want to write wrong answer essays in your prof, you follow these two books. But now I think even coaching materials have enough content for you to write essays. Among these, I would recommend Manipal Manual of Surgery because it is a little thinner as compared to SRB.
Now coming to peds, if you are in AIMS and you have to pass the peds exam, you need to read Ghai, because the most of the chapters are written from professors of AIMS itself, right? Plus you supplement it with NICU protocols of AIMS, they're given on the website.
Yeah.
That is enough. And Ghai is a beautifully
Beautiful
written
book, yeah.
book. These are some of the rare books standard books which I read in the MBBS. And what I did actually was, I had very little time, and I got to understand that I cannot pass peds just by videos or just by coaching notes. So I actually read the underlined Ghai from one of my seniors,
Okay.
and that is what I did. So Ghai is a beautiful book.
Now in Ghai, especially general pediatrics is beautifully given.
Neonato is
very, very nicely given, right? So you should definitely neonatology. ये तो पढ़ना ही पढ़ना है. This you have to read from Ghai. No other option. No other coaching notes. Throw them. These things you have to read from Ghai. Like plus, if you want to prepare for NEET PG or AIMS point of view, also read NICU protocols which are available from AIMS NICU website. You can directly download them for free.
Now coming to gynae, in AIMS, most of the people read JB Sharma, who is our professor only, and however in most of the colleges DC Datta is preferred in ops.
Yeah, both of them are good books.
For ops. And for gynae, Shaw's is something which you will hear about, but what you don't hear about is the John Hopkins manual for ops.
Yeah,
which is a beautiful.
Yeah, and this is again a very nicely written book. And since it's a Johns Hopkins manual, so again it will have official guidelines. So society guidelines, ACOG, RCOG guidelines. Oncology is beautifully given here. So do definitely read oncology. Cervical cancer very nicely given. Ovarian cancer, endometrial cancer, vulval cancer nicely given. Again, in fact, I would say fibroids are nicely given in Johns Hopkins manual. Right. In fact, for obs and gynae, most of the coaching material is also pretty good. Right. So if you're just following coaching material, it's good enough. It's good enough.
Now coming to PSM. So what I honestly did was that I read Vivek Jain, and most of my batchmates, what they did is that for the health program, they specifically use Parks. So this is something which you can do, but if you don't get enough time, then you can just follow Vivek Jain itself.
Yeah, Park is a standard book again. Everybody would recommend. I would personally recommend at least epidemiology and health programs. You read from Parks. It's good. It's given nicely, right? Now,
and most of the college professors would say not to read Vivek Jain. Just they say in first year to read the Gray's book and not BDC. Yeah, same manner.
Now let's come to psychiatry. So for psychiatry, Dr. Praveen Tripathi's textbook, it's a review book.
I have read it and I've seen the lectures also. They're beautifully
Yeah,
given.
they're good. They're
At
good.
our time, there was a revision video of 4 hour, and in which he had like summarized the entire psychiatry.
Psychiatry.
And I had actually passed my second prof, third prof, and final prof exams of psychiatry using that. And in PSM also, there's a psyche viva as well. So
Yeah.
that is a beautiful resource.
Yeah.
And apart from that, over to
Yeah.
you.
So there is one very nice book. So if you want to, enjoy psychiatry and read psychiatry for the fun of it and not for PG point of view, which I think you should. So this Oxford Manual of Psychiatry is a very good book. Again, it's a handbook.
So if you're some of them, one who loves to see Netflix thrillers, psycho thrillers, and you want to dive deep down into psychiatry, you can.
Yeah, it's a
read
nice
this.
book. So this Oxford Psychiatry has 2 books. So again, like Mummy Grace and Student Grace, there's a big Oxford, and then there is a Oxford Handbook Manual. So it's a shorter manual. It's the choti hai nahi ho, but it is called handbook. It is nicely given. Again, official DSM criteria, ICD-10 criteria for depression, manic disorders, psychosis, everything nicely given there. Similarly, everything is given in Dr. Praveen Tripathi's book also. But if you want a storytelling, easy-going book, so this is a nice book that you can read. Now for minors, let's come to minors. Minors are no bullshit. So one book, one minor. So ortho is standard. Dr. Maheshwari's. Jitendra Maheshwari is an Aimsonian, by the way. So I met him in one of the Aimsonians dinner, annual Aimsonians dinner that
Which
we
happens
have.
in October usually.
Yeah, which happens in October, and he's the author. Nicely written book.
For derma, you don't need images from anywhere but Nina Khanna.
Yeah. Nina Khanna is the gold standard, which even people outside India read.
So
right?
Professor Nina Khanna ma'am took my viva as well. Just sharing this point. And in her book, the initial there is synopsis given.
Yeah.
And it actually summarizes the entire chapter. So if you don't have a lot of time, you can read through that synopsis as well and see the images.
And see the images, right? Now, ENT, again, very standard textbook, Dhingra's. So, very nicely written. Dr. Dhingra is a very senior ENT surgeon, and everybody in India follow Dr. Dhingra's ENT textbook. Now, Optha, unfortunately, does not have a very good book. So, Parsons is the standard book, which usually seniors used to say, but it is not easy. It is easy to read, but it is not sufficient, right? And Khurana is sufficient, but it is not easy to read because it is written in a very bad format. So what people usually end up doing is leaning back to coaching notes. So both Dr. Ruchi Rai's and Dr. Utsav Bansal's coaching notes are nice. You can, they both of them have their standard textbooks. Dr. Sudha Sitaram also has her standard textbook of ophthalmology. You can refer to that, or you can refer to your coaching notes. Anesthesia, this is a textbook for anesthesia, Primer of Anesthesia by Dr. Rajeshwari. This is again a very nice book. Dr. Rajeshwari was an ex-professor at AIMS, and she has beautifully written this book with lots of diagrams, lots of instruments incorporating into this. Now, forensic, lot of different opinions. Parekh, there is another book I'm forgetting, Modi, I think. Yeah, but I followed this small textbook, R.K. Sharma's.
And all of the seniors recommend this.
Yeah, very short, crisp, to the point, forensic, which will help you pass your professional exams. And again, for PG point of view, you can just refer to the coaching notes. Okay, coaching notes for FMD.
That should be enough.
Yeah.
And you really need to remember some of the articles and numbers and and keep them into your 20th notebook so that you can revise them.
So forensic is a proper PG subject. You can read entire forensic from your coaching notes as well, right? Not much of concept. Most of it is unfortunately rote learning.
Now coming to the fact that you have to maintain 75% attendance compulsory in your college lectures. So how to go about them? So in most of the colleges, what happens is that the lectures are quite erratic and it is difficult to follow through the schedule of those lectures and read them after coming home. The better idea is to stick with your posting schedule and read at home what is being taught in the posting. And if you find that there is some good lecture and you anyways have to maintain that attendance, so please make good notes of them. They'll be helpful during your later part of revision as well.
Yeah, in fact, I remember, Aman, one of the faculty at AIMS took a lecture on upper GI bleed. And it was such a beautiful lecture. I remember Dr. Pramod Garg took a lecture on upper GI bleed. and he taught the entire upper GI bleed management in like 40 minutes. Everybody was making notes. He wrote it on the blackboard. It was like a proper blackboard teaching. And those notes I read in prof, I read in PG, I read it for quiz. They were so good. So if your faculty, some of your faculties teach really well, for example, AIMS में pediatrics teach really well. Medicine faculty, super specialty faculty, cardio, gastro, neuro people teach very well.
And that is very good.
And that is very good.
First year
तो
तो
everything
anyway,
is good, yeah.
everything is good.
So make lectures. ऐसा नहीं है कि you have to only follow coaching or textbooks. If there are good lectures, make notes. You can make them as your primary source also.
Now summarizing what was told in this video. So third year is a honeymoon phase, but if you gear up right now and start with a consistency in your studies, you can definitely achieve a great rank in your PG. Now, what you have to do is you have to read the main coaching notes and supplement it with the videos for only those topics which you feel are difficult and you cannot understand. Read the standard books and add them into your full coaching notes as well, so that you can revise them later. And please highlight your notes in a manner so that you can revise it later.
So ideally, what is an ideal way to do it? To make your own notes. But that takes a lot of time. So during our time, I think not your time, but during my time, these widely publicized coaching notes were not available. So we used to attend offline coachings, make notes there, and then add extra stuff from textbooks. For some subjects, direct textbook reading was the norm. For example, pediatrics, everybody just used to read textbooks. But now, since most of you will join a coaching, you will have its coaching notes, make them as the base, add textbook material plus minus videos. That's the whole summary, right? Now, even if you're able to cover 60 to 70% of this material, let's say medicine has 200 hour of videos, right? Or it has 4 modules. Even if you're able to cover 60 to 70% of this content in your third and fourth year,
mind it, you are not watching the videos for every topic. Don't get confused. So if there are 1000 pages, you are able to do even 600 to 700 pages. That is enough.
That is like a win. You are ahead of the race.
And in your third year, try to cover just 300 pages, like or 35%.
For your major subjects, like for third year subjects, तो 100% करना ही है आपको. For your final year subjects, at least 50% is ideal, so that your final year is a little relaxed. So that is all from our side. And I hope you like this video. This was a detailed video. And
please do comment below if there is any other topic you want us to make a video on. Thank you so much, Dr. Rishabh, for inviting me.
Thank you.
And I wish you all the very, very best for your prof, for your PG. And I hope that you become a very good doctor.
Okay. Bye-bye.